And it's all about a seamless exchange of healthcare data. So Humana avoided a rip and replace approach to that, modernizing their legacy systems, and built a cloud-native core data fabric with MongoDB that extracted the data layer from their legacy systems of record. So Levi is going to share the architectural insights of that, as well as show how their core data fabric is ushered in a new era of digital transformation for Humana. So please welcome Levi Bailey to the stage. Thank you.
Well, thank you very much, Shane, for that introduction. You know, who doesn't like to start the morning with statistics? I mean, I wake up every morning, that's the first thing I do. You know, back in 2019, I will say this is my first conference in 3 years. It's just awesome to see people in person. I mean, the last 2 that I've done have been remote. And I'll tell you, that's the hardest experience ever. It's way easier to speak in person than it is remote, I'll tell you. It's odd, but it is. But back in 2019, there was a study done by the University of Pittsburgh. And in that study, they found that there's almost $1 trillion a year of waste in the US healthcare system. $1 trillion every year. And in that, 25% to 30% of it could be directly attributed to lack of interoperability, the inability to share data across the different participants in the healthcare ecosystem. So first, let's talk a bit about what does interoperability actually mean in healthcare? Because I mean, I think it's important to understand why it's a big deal and why we need to figure out how to solve it. There are 3 kind of pillars to the US healthcare system: consumers, payers, and providers, right? Consumers are the patients, providers are the people that are facilitating healthcare through patient interactions, and payers are facilitating the financial transactions of healthcare. Now, each time that you're interacting with one of those, you're kind of interacting as a different, kind of in a different role. And there's an intersection between all of them where there's a lot of rich data that can inform those interactions across those different things. Like you go to one doctor, you get a test done, and then you have to go to a specialist. Well, you need to be able to transfer that data easily so that they know how to treat you better. And in fact, if you look at the US healthcare system for years, it's always been what we call a fee-for-service model, meaning that, hey, I go get an MRI done, you're going to get paid a certain amount as a provider for doing that MRI. As you can see, that can kind of lead to waste, because if I get paid for the services that I do, it incentivizes me to do more services, even if they're not necessarily relevant or would lead to a better outcome. And one of the things that Humana has strove to do, and we're seeing a big trend of this in the US healthcare market, is move to what we call a value-based market. Basically, every patient, we say, hey, I'm going to pay you $50,000 for this patient. And every time you do tests and other things, we're going to deduct from that, and we'll pay for it out of that. And then basically, the intent is to get the best outcome with the least amount of effort so that it's the least frictionless experience for the patient. So basically, if you can solve the problem for the patient in the least amount of effort, you earn more money for that patient. So the way we have to facilitate that, though, is through interoperability, because we have to share data. We have to have that data available. We have to be able to generate insights. We have to be able to generate meaningful insights about a patient so that they can make the right decisions for the patient and do the least amount of just exploratory work. So that's the opportunity. Now, why is interoperability not really taken off until now? Why is this a problem in US healthcare? Well, one, there wasn't really a driving factor to push for it. Recently, you know, I think with the Obama administration, they started adding some regulations in there to try to encourage healthcare interoperability by creating some industry standards, which a lot of different players such as Humana participated in defining these standards. But they mandated that now we have to expose all that data. Now what this does is it does a few things for the consumer. One, it enables us to have price transparency, right? Be able to share our data. It makes it easier for us to switch between healthcare companies. So all these things kind of drive the market to lower cost and also try to force companies to create a better experience to get you to continue to stay with them, because it's no longer just, hey, you kind of get locked in with what's going on. So what does FHIR actually mean? And why does this, why did we need to find a new solution for this? Well, first of all, FHIR is built on what every industry is built on anymore, and that is APIs, right? It's an API standard. But the API is the how we communicate now in healthcare. Instead of doing it used to be a lot through file transactions and other types of things. It's getting more to a digital age. But the FHIR component of it is the what we communicate. It's how we talk together, right? It's set on a set of resources that are critical to the healthcare industry. Whether it be research, public health, you can see a number of the things listed up there. But all of these things will impact the ability to offer better care and have better outcomes for our patients. Humana in particular as a company decided even before regulations came out that we were going to jump on this bandwagon because our goal is to transfer ourselves from an insurance company with elements of health to a health company with elements of insurance. The only way we can do that is to focus on the member and the patient. And so this data, and we have a lot of rich data because all of the medical records and things come through us because we have to pay them, right? So they have to submit all that information to us. So we have it all right there for the patient. And the ability for us to share that data out can really impact and make people healthier within their medical journey. So when we look at the curve of where we're looking at, we see this as a competitive advantage. And right now, we kind of sit there as the second leader in interoperability in the healthcare space, and we continue to plan to push that. One of the notes here that you see is with Kaiser Permanente. I don't know how familiar everybody is with the U.S. healthcare market, but I think most people would probably think of Kaiser as a hospital system. I mean, that's what I've always heard. Well, that's why their interoperability is so high. They're a closed network, kind of like Apple, right? Everything in Apple works because it's closed systems, right? And so that's the way Kaiser is. Whereas Humana, Anthem, Blue Cross Blue Shield, all of those guys, we work in the global market, so we don't really control the provider. It's not like a closed network. We're working with other providers. And so it's a little harder for us to create interoperability because it requires us to be, work across standards and make sure that the providers we're working with support those standards and so on and so forth. So I say all this to just kind of start the framework of saying you have to understand your problem before you define your solution. So that is the mandate, and that is what we're trying to do here. And so when Humana kind of set back on this and said, all right, how are we going to solve this problem? One of the challenges we have, and I'm going to say right now, I don't think it's fair that you all get to ask me questions and I don't get to ask you questions, so I'm going to ask you all a question right now. How many people in this room work for a large enterprise that maybe have multiple legacy systems or have worked for enterprises that have systems that have been around for 50 years or 20 years? Raise your hand. Okay, well then this is very relevant to you because I've worked at a lot of different places and that's a standard thing, right? You deal with that and it's hard to modernize. Modernization is not an easy task. It costs money, it's difficult, and sometimes it's just not practical. So how do you move yourself into a digital era when you're working off of things that were not built for the digital era? I can't really go and build an API against a mainframe data store and expect it to be able to serve the needs of a consumer base that I can't even predict because that's the idea. I'm trying to open it up and allow people to consume data. I've got to have my data systems to support that, but I can't just go change the entire platform overnight because that might be our core operating platform that does everything that our business relies upon, and they don't want to touch it, or it just is going to take 15 years to get it updated to be able to support what we need. So that's not really a workable solution. So when we looked at it, we said, we kind of used some research that you saw from Gartner and other places where companies like Stitch Fix developed a data fabric. The idea to say, hey, we don't have to go change all our systems, but we do have to be able to share that data easily and make it available and put it in that scalable layer that will support those digital experiences and analytic experiences and things that we want to do. And one of those key components is the idea of saying, well, when you think about that, what you're really doing is creating an optimized data store. You're taking it away from the system of record and creating a trusted source that is optimized for the use that you're going to use it for. So these became our design principles. We said, okay, we have platforms as a service, we have operating platforms. These things are basically creating either experiences or are driving the data that will enable those experiences. But we can't put that requirement to be able to serve that data and meet the needs of a digital age on those operating platforms, because it's just not realistic. They can't support it. You're putting demands on them that they never signed up for. And so we said, okay, well, how are we going to do this? Well, first of all, in the healthcare market, if we're talking about interoperability, it's important that we say it's consumer-centric and it's payer-agnostic, meaning it can't be about just Humana members. It has to kind of be able to be global to the patient, because in the new world, we expect people to be switching insurance plans based upon what the better plan for them is that year, and be able to take their data with them, because you're the owner of your data, right? As a consumer, you should be the owner of your data. It needed to be based on open standards, because if it's not based on open standards, how are we going to support any of this? If we're going to support a digital experience that we can't predict, who's going to use it when, and also create more third-party experiences. That's the other thing about this. It's an open standard. It's not just health plans. Now it's Apple Health that integrates and pulls this data in and creates a unique customer experience for you to own your data and use your data and manage your health as you see fit. Well, in order to do that, that means we're going to be taking a lot more demand, and trying to do that in a traditional data center just isn't feasible. It's not where we need to be. So we said, well, it's got to be cloud first, and we want to use the public cloud. So, we got to take advantage of that scalability. And then the other key concept, and this is why, when we did it, it's not just about one technology, it's about a group of technologies. We said it should be event-driven, right? We want to be able to, because we're taking data from source systems and we're making it available, we got to make that data available in near real time. And you can't do that with point-to-point connections or traditional ETL. You need to do it differently. And so we really cemented on an idea of an event-driven architecture. And then the other thing that I think is really critical, obviously, to the people in this room, since this is what this conference is about, is that we had to optimize that data for use. And if you look at APIs, what is very apparent about any sort of resource model-based solution is that it really fits the document model, right? And that is the benefit of choosing a document database as an optimized data store for this use. It just fits. It makes sense. It's the right tool for the right job. And then we need to be able to support analytics, because the reality is, when we talked about how are we going to make people's outcomes better and do it with less testing and all these things, we have to be predictive. We have to be able to take insights and generate insights. And we have a lot of examples where we've done that at Humana, and it's really cool stuff. And we'll talk about some here in a bit. But that was a key design principle that we wanted to go forward with. And then also, we've really started making the move to a product mindset. And I think that's hard for a lot of companies where you're used to working on projects and things like that. But we wanted to take this forward and say, what is our vision, what is our future, and how are we going to align this to be able to support that vision and future? So these are kind of the key components of the platform. We need an API platform, because we're going to be serving all this stuff through APIs. We want to be able to support event management, to share this data. And we also want a knowledge graph, because we want to start being able to tie the connective, talking about analytics and be able to generate those insights. We have to be able to tie them together. We have to be able to understand, this claim or this claim code that references this condition also relates to potentially diabetes or something else, and be able to make that insight quickly. So being able to create those connections between the different data that's flowing through the platform is critical to be able to do that. And then last, we need to be able to persist the data in an optimized fashion so that it supports the needs of the consumer. And this is kind of what we align to from a technology stack perspective. So we use Mongo Atlas, because Mongo Atlas gives us a scalable infrastructure that is fully managed on the cloud and supports the needs of a resource model-based solution such as FHIR. We use stream sets, and part of the reason why we chose these technologies in particular is that underlying Google Cloud platform you have there, we're now expanding to Azure. And we're also expanding to AWS, so it's a multi-cloud platform. So that core foundational piece, we didn't want to tie too tightly to by using vendor-native services. We wanted to use cloud-agnostic solutions that were built for cloud so that we could easily transfer them across those different vendors and have a more robust framework. So with that, let's kind of walk through, and this is the fun part for me, because I'm an architect at heart. Let's walk through an architecture of how we do this and an example of how this all fits together, all these pieces come together to solve for this. So first of all, you kind of look up at the top there. That's our operating platforms. Operating platforms are serving data in. We're pulling that data out of them. In this case, we're doing it via a Kafka stream and ETL pipelines. So that data comes out of the core system, and then we're going to process it and turn it into what we need from a FHIR perspective. Now, this is the other complex thing and the reason why this works so well. The operating platforms weren't designed for FHIR. They may store data in a way that doesn't really meet the resource needs of the FHIR resources that were described earlier. So we have to do some work to kind of break it down and aggregate it and move it around and make it look like the thing that we need to provide for our customers. So if you look at that next layer, this orchestration layer, this is where it's taking that data and it's splitting it apart and creating multiple topics and multiple areas of concern and breaking it out into those core FHIR resources so it's easy to conform to the FHIR standard to be able to present to our consumers. The next thing we do is we store it in the optimized data stores. So now we're taking that data, breaking it down, storing it into the optimized data stores that make sense for those resources, and then having it readily available for the consumers as requests come in. And then last, we present it through the integration layer, through those API interfaces that represent the FHIR standards or the FHIR resources. So it's a relatively simple flow, but there's a lot of complexity that goes into that of breaking it down and taking that data and making it fit the need that we have. So I think the best thing to do is talk about how this has been successful. And honestly, I think COVID was a huge, they talked about earlier in the keynote how we weren't sure how COVID was going to affect things, but it really mandated people become digital because there wasn't as many people going in and consuming services in a standard way. So what we saw during COVID was the ability to leverage the investments we made in doing this to support some COVID-specific use cases, including utilization management, which was all about, I know during the kind of core of COVID, hospitals were at capacity, right? You as a member, if you were going to go to the hospital, we wanted to be able to tell you, don't go to that hospital, they're at capacity. Go to this hospital over here, right? Because we need you to get in. And so those are things we were able to do with this platform by taking that data in from the hospitals, creating resources, having that available to report up to dashboards that were made by third parties, and help inform our members and even integrate with our members to let them know, hey, you need to go here, not there, which saves lives, right? I mean, and that's our goal. So there's a couple use cases here that I think are pretty unique. And the first one, Signify Health, we'll talk about. What's unique about that one is that's more of the standard. But what we were able to do with that was really, we talked about impacting the patient experience. That one impacts the patient experience. What Signify Health is they're a provider that does in-home health assessments. So our primary business is Medicare Advantage, and Medicare Advantage is basically the government as a payer, but we're doing it on their behalf for people over the age of 65 when you qualify for Medicare in the U.S. It's kind of like the public health care system in most countries around the world, but it's the U.S. version, and it's only for people that are retired. Within that, there's a lot of requirements, and anytime somebody has an event, they have to go to the hospital or whatever, and they get discharged. One of the follow-ups within Medicare that you're required to do is send in a provider for in-home health assessment. Now, there's a lot of good things that happen out of that. One, sadly, you'll find that finances become a big concern for people. I get out of the hospital, I get home, I've been prescribed some medication, but I don't feel like I can afford it, so I don't get it. Well, guess what? What's the biggest indicator of you getting better from the thing that you're sick from? Take your medications. If you don't, you're likely not going to see improvement. So what we're able to do with this at the home health assessment is basically go in and check and make sure that they're following the care regimen that was prescribed to them, that they're fulfilling the medication, that they're taking the medication, that they're getting the support they need, that they don't have an issue with food insecurity, that they can get the food that they need. That's what that home health assessment does, is be able to kind of determine that. In the past, the way that worked, because it was a disconnected experience, basically we said, hey, you got to go do this home health assessment, and we would send them whatever data we had available at the time, but that was the end of it. Then it was up to the provider to take that data and try to go into the home and get the information back out. But that created a very disconnected experience for the member. because they don't have the current information. They don't know what we know at that time. It's especially medications, because we basically see the claims that come through. We can see if they fulfill that prescription, and so on and so forth. And they don't have that information at hand. So it would lead to an experience where they're asking them, hey, what medications are you currently taking? Or they'd have to go look around the house and try to find, hey, what medications are they taking? And the reality is, these are elderly patients. And oftentimes, elderly patients, when they have an event, they can have dementia or other types of things where they don't remember, or it's a nervous experience or something where they can't inform the provider that way. So what we were able to do is take the FHIR standard, that previous blueprint you saw was pulling data from the medication system, and get all of the information we had about them available via these FHIR APIs that then we could directly interface in the provider system. The provider didn't have to change their system because it was built on those standards. They could use Smart on FHIR, it directly integrated into their mobile app, and then they could have real-time data about what we knew at that moment when they went into the home of what medications they were taking and what dosage they were on, and so on. And then they could go and use that to start the conversation, saying, I see you're taking this. Have you, it's a more informative conversation, less friction, better for the patient, and better outcomes. And then not only is it providing information to them, but they were actually able to update us with the information that they found. So if they found something different, they could update that record, would come back to us, and we feed it back into our operating platforms, and now we have that information on hand. So that was a really cool one that just uses the FHIR standard as it stands and allows us to create a better experience for our members and better outcomes. The second one is more unique because it was using the FHIR standard, but it was using it for something that it wasn't intended for originally. What we saw was that, so Sound Physicians in particular is a third-party physician group that will go into hospitals and treat patients. They don't work for the hospitals, they kind of work outside the hospital. But in order for us to provide data to allow them to prescribe certain treatments and stuff, we have to know that they're working with our member. And because they're not part of the hospital system, they don't have that information. So when they go into the room, they can collect information, but then they have to traditionally go back out, ship it to somebody, and then that person would go do queries and look up and find out and create the connection between that individual and Humana, and then go and prescribe treatment. So it was a very disconnected experience, and it was costly because you had to pay somebody to go and look up and interface with the insurance companies to find out whose member this is, because they don't always have that information on hand. What we did is we took advantage of the 7 points of light, your name, different points, and created a FHIR resource using the FHIR standard, but kind of manipulated it to where we encrypted data into a hash that was sent back in the FHIR store that we could compare without them actually sharing any relevant data. So they weren't sharing the data they got, they were sharing a hash. They were able to take that hash and go bump it up against our data, which we preloaded into MongoDB stores and built these hashes, and be able to determine, hey, is this one of our members? Yes, it is. Okay, it's our member. Here's some data for you, and give it back to you, and then that would let them go ahead and start doing the care necessary at that moment when they're in the room. So just a new way of looking at a problem, saying how can we create a better experience for our members? So, when you look at this, I think there's a couple lessons to learn. And anytime I do a talk, I always like to kind of leave people with 3 points because I find 3 is an easy number to remember. I can't remember more than 3, so I'll start there. But the first thing you have to understand when you're doing anything is know your business problem. If you don't know your business problem, how are you going to create a solution? And the reality is, I think as technologists, sometimes we get so embedded in the technology, we try to use it for everything. Just throw it in I love this technology, I'm going to use it there. But I think it's important to first understand your business problem and use that to guide you in your solutioning from an architectural perspective. The second thing I want you to remember is that, if you're going to offer digital experiences, it requires you to rethink your data, right? Rethink your data approach. I think for years, the industry has been, we had SQL and that was our hammer, so everything was an L. That's just what it is. And the reality is that doesn't fit a digital world. It just doesn't. It's, digital experiences demand more and they work differently, and it just isn't a great tool for that job. And so you have to rethink your data approach. And then lastly, adaptability really is supported by having a modern data architecture approach. So, we invested in a platform approach with data and really rethinking and creating this data fabric. as an accelerator to be able to participate in the market and not have to go rip and replace everything, because frankly, that's just not doable. Like, there's no enterprise I've ever seen that can just like overnight transform everything to a new data architecture. You're going to be working with legacy systems. You're still going to be working with SQL stores. You're still going to be working with mainframe, because guess what? It's just too expensive for companies to justify changing everything out, and it takes too much time, and there's too much trust in those systems. So you have to rethink the approach and consider other ways that you can bring that data forward to support those digital experiences. With that, that's kind of my talk. So I'll open it up to questions. If anybody has any questions, I'll be happy to answer them.
Excellent. Thanks, Levi. Excellent. We got some questions. Just let me come to you with the microphone so we can get it on the recording.
So somewhat of a religious question.
Sure.
So I noticed you selected Google Cloud, but you didn't select their Firestore or their Apogee API gateway. I'm curious why you did a kind of a mix and match.
So the reality is, Google Healthcare API was used by part of our FHIR thing. So the full architecture for this does use a Firestore. But the problem with the Firestore implementations is it does really good with writes, but it doesn't do good with deletes and with some other things. There's a lot of limitations to that. So we kind of pre-aggregate in Mongo, which gives us a little more flexibility, and then we serve it up into those FHIR stores. And there's a reason why you want to use those from a FHIR standard perspective, because there's things like conformance statements and different search parameters and various FHIR-specific things that dictate that you have a FHIR server to support that full standard for the FHIR standard. So we use that in combination, but Mongo's kind of like that jumping off ground to be able to support it and make it easy to write that data to those FHIR stores. We also use Azure FHIR Server as well. So we have a couple different companies in there. We're using both. We're a large company, so we have different subsidiaries that we're hosted in different places. Huh? The API is running, in Google FHIR Server, it's actually stored there. It's built on their FHIR Server. Same thing with Google Healthcare API. But our APIs were running in App Server on Google, serving from Mongo.
Any other questions here? Sure.
Yeah, thanks. Great talk. We're building kind of similar platforms only in the energy industry, especially around the data mesh perspective. You mentioned that the operational data stores in which you put, or at least collect data that comes from different data sources. Do you do anything with lifetime management on that data, or is it going to be kept in there forever?
No, we do lifetime, and one of the things we're looking at with Mongo, which we're excited about, however, right now it's just in AWS, hopefully it expands to GCP and Azure as well, is the ability to have the archive storage. But what we do now is we run our own processes to determine what data can be archived, pull it out, and only keep the data that we need for active use within our Mongo clusters. So it is. When you look at the data fabric, we have different tiers of data, and we do use object store to store a lot of that in Parquet files, and we have our data lake supporting that. So it is a bit more complex than that, but yes, we do take that into account.
Thanks. I'm glad I'm not the only one then.
Yeah.
Okay, we've time for one more question if there's any other question in the audience. Over here, 1 second.
Thank you for a wonderful talk. I was just trying to understand how are you making use of these stream sets versus making use of Kafka as your data pipeline. As I understand, the working mechanism behind stream set is to move the data. So you were using stream sets to move the data into Kafka?
Yeah, so stream sets sometimes, so stream sets we use as a processing layer for pipelines. So yeah, for our batch pipelines, because we do have some batch pipelines still, some things aren't Kafka topics that we can use, or we'll use it to read that batch file and then publish it to Kafka using stream sets as a pipeline. But it is basically what stream sets works really well with in Kafka is kind of like a compute layer to do complex event processing concepts where I may want to read from multiple streams or from a file and a stream and then publish to a new topic. I can do that using a simple experience with stream sets as a processing layer.
And the data from Kafka eventually lands into Mongo?
Yes, or other places. Yep.
Okay. And if it does land into Mongo, have you had issues with throughput or?
No, actually, we've done very well with that. In fact, Kafka and Mongo work really well together, actually, in my experience.
Awesome. Thank you.
Excellent. Well, thank you very much. Levi, that has been superbly interesting to share your interoperability journey. Thank you very much.
Thank you.
A big hand for Levi Bailey. Thank you.
Thanks, everybody.